Hey guys, this is Dr. Hub. Today we'll compare the ALL versus the AML. So what does this mean? ALL stands for the acute lymphoblastic leukemia versus the acute myeloid leukemia. Acute myeloid leukemia. Now we are going to look at the morphological features and we are going to compare how are the blast cells. So first we are just going to look at the lymphoblast. So as per the lymphoblast, the blast population is going to be, it is homogeneous. And how is the size of the lymphoblast? It is going to be variable. The size is going to be variable plus it is small. Then how is the nucleus of the lymphoblast? Now if you look at the nucleus, the lymphoblast, it is central and it is mainly round. It is round and it is also indented. It is indented sometimes. Next, let's look at chromatin. So we look at chromatin and this is going to be of the lymphoblast. Chromatin is going to be fine. Chromatin is fine and it is dispersed condensation. There is dispersed condensation. There is also very condensed. They are very condensed in the small lymphoblast. Very condensed in the small lymphoblast. Then let's look at the nucleoli. So in the nuclei it is absent. There is absent in small lymphoblast. So there is absent in the small lymphoblast and it is sometimes it is indistinct as well. So this is all in the nucleoli. It is absent in small lymphoblast and sometimes it is indistinct. Then we move on to the cytoplasm. So as per the cytoplasm, it is scanty and basophilic. It is scanty as well as it is basophilic and sometimes with a single long projection. So it also has a sometimes with a single long projection. So that is a hand mirror cell. That is presence of the hand mirror cell. Then we look at the granules. So as per the granules, it is rarely present. It is rarely present. It is going to be negative. The granule, it is negative for the peroxidase. Negative for peroxidase. It is negative for esterase as well as the toluidine blue. Toluidine blue. So as per all this, it is negative. Then we look at the OR rods. So comparing the OR rods, it is going to be positive. It is not positive. The OR rods, it is absent, that is it is negative. Then comes the vacuoles. The vacuoles, it may be present. Then we'll be moving on to the myeloblast. So the myeloblast, the blast population is going to be heterogeneous. It is heterogeneous and it is with the exception of the undifferentiated forms. So exception here is the undifferentiated form. So how is the size of the myeloblast? It is variable. So it is variable and it is mainly large. Next, how do you call the nucleus? The nucleus is eccentric. The nucleus is eccentric. It is round, it is oval and it can be angulated as well. So it is angulated Then it is sometimes convoluted. Then it is particularly in the form of the monocytic component. So it is particularly in the form of the monocytic component. Next, let's look at the house chromatin. So when you're looking at the chromatin, it is fine. The chromatin is going to be fine. It is granular, as well as it is delicately dispersed. It is delicately dispersed. And what about the nucleoli? The nucleoli is present. It is present. It is large and prominent. It is going to be large as well as it is prominent. And it can be double or triple as well. It is double or triple. Next, we look at the cytoplasm. So how is the cytoplasm? The cytoplasm is variable. Cytoplasm is variable. There is abundant of the monoblast. There is abundant of the monoblast, and there is a protrusion in the erythroblast. There is protrusion in the erythroblasts as well as the megakaryocytes. Next, let's focus on the granules. So when you're looking at the granules, this is going to be present. It is present in forms of differentiation. So it is present with differentiation and positive with the cytochemical stains. So it contains the cytochemical stains. And what else do we have here? There is the peroxidase in the neutrophil. Peroxidase is present in the neutrophil, as well as there is non-specific esterase. There is non-specific esterase is the monocytic lineage. Monocytic lineage. Then comes the presence of OR rods. So OR rods, are they present? The answer is yes, it is present, and it is typically present in the hypergranular. So it is present in the hypergranular promyelocytic form. Promyelocytic form. Then we will look at the vacuoles. So the vacuoles in case of the lymphoblasts, can be present. So what about here? So the vacuoles in the myeloblast can also be present. It is always present forms with, so it is almost present in forms with the monocytic component. So they are present in forms with the monocytic component.